So in this first phase of the corrective exercise continuum, I will be performing exercises for valgus knee. So the first phase always is to inhibit the overactive muscles. One of the overactive muscles for valgus knee is your tensor fascia latae. Yeah. So really, how you'll do this, you can perform a self-myofascial technique using a foam roller or a tennis ball. I'll be using a foam roller. And how to do this is you'll just want to place the foam roller on the ground and like really lift your body up so you can place the foam roller like right here. It's located above your hip or on your hip. Really, it inserts on your IT band or into your IT band. And since this is like a small muscle, it won't be as much movements to do. So really, you can stay in this upward position, or you can get down on your elbow. I'll be getting down on my elbow. And you'll just want to roll back and forth right here in this area. And if you're like a sprinter or a runner, or mainly sit down, this may feel uncomfortable for you. In the second phase of the corrective exercise continuum, you're going to be lengthening the overactive muscle, which is in this case your tensor fascia latae. So in this stretch that I'll be doing, you mainly want to get into a lunge position, just like this. And now you want to place that knee that's up over to the side you'll be stretching, which is my right side. And you also want to make sure you have like something next to you that you can hold on to, because you may lose your balance as you're doing this. And really, after you bring that foot over to the side that you're stretching, you just want to lean in. And as you're leaning in, you should be feeling a stretch right here on your TFL. In the third phase of the corrective exercise continuum is to activate the underactive muscle. In this case, they are my glutes. Ideally, when I squat, my legs go in. But as you'll see when I'm performing this, my knees want to go in, not my legs, but my knees. My knees want to go in, but it's my job to activate my underactive muscle, which is the glute, to force my knees out. So really, to do this, you just want to place the band right above your knee, which I already did, and just step shoulder width apart with your toes slightly pointed out. And now you're just going to go down into the squat. In the fourth and final phase of the corrective exercise continuum, we're going to be integrating, meaning we're taking phases 1, 2, and 3 and putting them all together for one movement. And the exercise I chose to do today will be ball wall squats. The reason why I chose this, ball wall squats with a resistance band. The reason why I chose this exercise is because I feel like that the ball will take balance off. Well, it will not only take the balance off, but it will also help you focus on strengthening those underactive muscles. And with the band, it also forces your knees to go out instead of going in. And like the main problem that people have while squatting is their knees, or not their knees, but their balance. Other than you having valgus knee, of course, but your balance plays a major role in it as well. So, how to perform this exercise. So just grab a ball, place it on the wall. You want to place it right there on your lower back and also lean into it. While you're leaning, you also do not want to arch your lower back. At the same time, you want to walk out a little bit, making sure that your feet will be parallel to the ground as you're squatting. And you also want to tighten those core muscles. Now, squat. And as you're squatting, you should feel the band pulling your legs out. And you have to perform this for about 3 sets of 10.